Hey there. One day post-op, had surgery yesterday at Lord's Hospital in Manila. I got there at 5 a.m. and then changed into a gown, a cap, and removed bracelets and all that stuff. It was pretty straightforward. Got the anesthesiologist came in and said my leg would be numb when I woke up. I guess I used a block, and then general anesthesia as well. Next thing I know, doc came in, said hello, should be quick. Lights out for Robert. Woke up. Apparently the doctor talked to me after I woke up. I have zero recollection of that, but it was, yeah, easy procedure. And then I didn't realize my leg was going to be numb all day. It was numb until I went to sleep last night. Solid 12 hours of numbness, which was actually kind of crazy because that didn't happen when I did my left knee in Austin a few years ago. So that was new for me, and it made it a little bit more dangerous post-op, like getting home and stuff like that. But I had helpers help me get home. A wheelchair, which I'm glad I used a wheelchair and didn't try to just use the walker. I did get a little walker that helps me out. And then, yeah, heavy wrap on yesterday, so wasn't able to really ice it. I saw the doc today in a post-op visit. He cleaned up the wound a little bit and rewrapped my knee. Said swelling looks good. It's not that swollen. I was able to get my cold therapy machine, which circulates cold water around my knee with a little wrap thing. The struggles yesterday were I couldn't really bend my knee or feel my leg. So emptying the stoma bag was a challenge. Couldn't really bend my leg. So it was a different challenge. 2-in-1 special, knee plus ostomy, just next level gymnastics. Regardless, got my cold therapy machine. I'm gonna elevate my leg. I did something ill-advised on the way back from the doctor's appointment. I walked back about 1 kilometer. Like my leg probably gonna swell a little bit, get inflamed a little bit, but it's better to get home quicker than just to be standing here waiting for an Uber for 15 minutes. So walked, no pain, got back fine. I'm gonna elevate my leg, get it above my heart, get the cold therapy going on it, and start doing my rehab exercises, which is a lot. Ankle pumps, leg lifts, which I've done about 60 this morning. What I haven't been able to do successfully this morning, because there's too much swelling and too much fluid in my knee, is the quad sets, which is basically just pushing my knee down towards the surface, which will tighten my quad. And there's just too much fluid in the knee to do that comfortably right now. So gonna hopefully get the swelling down, get the literal juices out of my knee so I can do some quad sets. Leg lifts, ankle pumps, quad sets, and flexion, which is just basically pulling my leg in to get the bend. And I can't do that because, again, the knee juice. What's promising is I'm able to walk around, and that's great. I'm not a normal gait. I'm definitely tender on my leg, but there's no pain. So I'm just trying to be ginger with it. So that's post-op update, simple as that. Shouldn't have walked, I did, but we shall persevere, carry on. Stitches come out in a week, so that will be good. And then we'll progress from there. Start rehab in maybe a week as well, and like start really getting after it and trying to get some strength, not just strength in the legs, but some mobility back. Doc asked what my next tournament was. I told him maybe the end of November in China, and he said, you'll be fine for that. Today is October 3rd. That's a little over 6 weeks out, which is my goal was to get ready for India in December, and it seems like I should be very good for that one. But excited that I got my knee done. He showed me the videos and pictures. You could see a very clear cut in the cartilage, all frayed and wavy in the video. He showed me how he cleaned it up and basically left enough cartilage to where if I need to get it repaired, sutured together in the future, which is a much tougher recovery than just a trim, no weight bearing to give it time to heal. So that's preferred by good orthopedic surgeons, because it actually keeps the cartilage and doesn't lead to arthritis at an earlier age. And I was just like, dude, I gotta get back on court. He was good. He was like, I'll trim it because you do need to get back on court, but I'm gonna not trim that much because I wanna keep your cartilage and let you walk for a long time. So good doc. You can tell that's a good doc. I appreciate it. I plan on competing for the next few years maybe, as long as my body will allow. But the goal right now is to play pro pickleball at a high level for the next few years and then slow down movement from there. Obviously I want to live a full life and be able to be active and move. This is kind of my window to perform and compete at a world-class level. So that's the goal for now. And it feels like the doc got me on the right path for that.